Hi there. I have a few questions just for you. Have you ever heard loud snores from your family members or your friends? Or are you constantly falling asleep in the daytime during classes? So, has it ever crossed your mind that this might be one of the many sleep disorders that exist in this world? You may find your answer through this video where we are going to discuss common sleep problems with the title of Sleep Disorder, an overview of common types and treatment options. To start, sleep is regulated by a variety of chemicals in the body such as gamma aminobutyric acid, GABA, and histamine. These neurotransmitters have opposing actions on the sleep-wake cycle, where GABA induces sleepiness, while histamine induces wakefulness. Hence, increased GABA and decreased histamine release will induce sleep. On the other hand, melatonin, a hormone, plays an important role in stabilizing the body's natural circadian rhythm as it synchronizes the body with the environment's light-dark cycle. The term sleep disorder refers to conditions that disrupt your normal sleeping patterns and affect the quality, timing, or duration of sleep, as healthy adults usually need 7 hours of restful night sleep. However, fret not because you are not alone. According to a report from the Asian Journal of Medicine and Health Sciences, 35% of Malaysians have some sort of sleep disorder, with more than 53% of them getting less than the minimum 7 hours of sleep at night. Some major types of sleep disorder that will be discussed in this video include insomnia, narcolepsy, Restless leg syndrome (RLS), and sleep apnea. Without further ado, let's start with insomnia. The word of insomnia is derived from a Latin word, insomnis, where it means without and somnus means sleep. The symptoms for insomnia include trouble falling and staying asleep at night, not feeling well rested even after a night's sleep, waking up too early, daytime tiredness or sleepiness, and irritability, depression, and anxiety. The risk of insomnia increases as you age, and certain lifestyle habits such as stress, drinking excessive caffeine, and having irregular sleep schedules can increase the risk. Insomnia is also usually associated with medical disorders and also mental disorders such as depression and anxiety. Let's now move on to the main medication used in treating insomnia. The primary pharmacotherapy treatment is benzodiazepines such as triazolam, istazolam, and temazepam, which the primary difference between them is just their duration of action. The benzodiazepine binds to the GABA receptor, causing hyperpolarization of neurons and decreasing the neurotransmission to cause sedation. Its side effects include causing psychological and physical dependence when given in high doses for prolonged periods. The patient also might experience drowsiness and confusion, cognitive impairment, or depression. It is also important for us to know that benzodiazepine is contraindicated in pregnant and nursing women, as it may interfere with the brain development of the fetus. The second medication is the melatonin agonist, which exert the same action as melatonin and have moderate effectiveness in improving insomnia. For example, ramen. Oops, sorry guys, I guess I'm a little bit hungry. What I really mean is rameltion. It binds and stimulates the melatonin receptors to induce and promote sleep. However, it may cause headache and abnormal dreams to occur. Besides that, there are also some over-the-counter medication for sleep disorders such as antihistamine, which is minimally effective in inducing sleep. Doxylamine and diphenhydramine act by binding and blocking H1 receptors and reverse the action of histamine to induce the sedative effect. However, it may give rise to anticholinergic side effects such as hallucination, confusion, dry mouth, and constipation. Antihistamine should be avoided in older patients and patients with glaucoma or urinary retention. Let's now move on to the second disorder, which is narcolepsy. It is simply the opposite of insomnia, as people with narcolepsy will have excessive daytime sleepiness. Narcolepsy is a neurological disorder that affects the regulation of sleep-wake cycles due to the lack of hypocretin. It can be characterized by excessive daytime sleepiness, in which some people may continue performing their tasks even while asleep. You might also experience cataplexy, which is a sudden loss of muscle tone that is triggered by strong emotion. Severe episode of it can body weakness, and this is considered as type 1 narcolepsy. Type 2 will not involve cataplexy. There are also some sleep-related hallucinations that can be hard to distinguish from reality, and also sleep paralysis. Narcolepsy is caused by the lack of a brain chemical called hypocretin, which regulates sleep-wake cycle. These may be due to various risk factors such as sudden changes in sleep patterns, genetic issue, head injury, hormonal changes, and brain tumor. Pharmacotherapy in narcolepsy is mainly to reduce the symptoms instead of curing it. Central nervous system stimulants such as modafinil, armodafinil, and methylphenidate are the first-line therapy for narcolepsy. It acts through indirect sympathomimetics by blocking the reuptake of dopamine transporter and noradrenaline transporter, thus increasing the level of dopamine and noradrenaline in the synaptic cleft. Patients may have headache, insomnia, tachycardia, hypertension, and suppressed appetite after taking these stimulants. Secondly, sodium oxybate and oxybate salt may improve nighttime sleep and control daytime sleepiness. It works as the GABA receptor agonist. However, oxybate salt can cause sedation, nausea, bedwetting, and sleepwalking. They are also contraindicated with other sleeping tablets, narcotic pain relievers, and alcohol, as it will lead to trouble breathing, coma, and even death. Next is tricyclic antidepressants, which help to reduce cataplexy by increasing norepinephrine and serotonin levels in the brain. For example, venlafaxine, fluoxetine, and clomipramine. However, they can produce side effects such as dry mouth, constipation, dizziness, and hypertension. Moving on, the third disorder that will be discussed is the Restless Leg Syndrome (RLS), which also known as Willis-Ekbom disease. It is a sleep disorder that causes an uncontrollable urge to move the legs. There is currently no known cause to this disorder. Patient will experience sensations that begin such as pulling, a feeling like an electric current, itching, aching, throbbing, or like bugs are crawling under skin while they are resting or after they have been lying down or sitting for an extended time. But this can be relieved with just some movements. Nighttime leg twitching also may be experienced by the patient. People with iron deficiency anemia and long-term health conditions such as chronic kidney disease, diabetes, and Parkinson's disease have a higher risk of having RLS. Besides, pregnant women also tend to develop RLS, but in most cases, the symptoms disappear within 4 weeks after giving birth. Moving on is the treatment option of RLS. Dopamine agonist is the first-line drug treatment. It acts by stimulating dopamine D2 receptors to enable normal body movement. The examples of dopamine agonists are pramipixole and propinerol. However, side effects are nausea, dizziness, and somnolence will develop if it is used in high doses. The next medication is the alpha-2 delta ligands that helps reducing leg movements. For example, gabapentin, enarcabil, and pregabalin, which are anti-seizure medication that inhibits the action of alpha-2 delta subunit of voltage-gated calcium channels in the central nervous system. It decreases the excitatory neurotransmitter release, thus reducing leg movement. The side effects also include dizziness, drowsiness, and weight gain. The third medication for RLS is the opioids, which help to reduce the pain. Oxycodone and codeine can be used during severe cases of RLS to relieve the symptoms. They work by binding to the opioid receptor and inhibit the anti-voltage operated calcium channels to reduce the transmission of pain signals. However, patients might become addicted to it and experience respiratory problems other than having constipation. Benzodiazepine, which was mentioned just now for insomnia, can also be used to treat RLS as it causes sedation and improves sleep. Iron supplement can also be used to increase iron levels in the brain to have a better control of movement. The last sleep disorder that will be discussed in this video is sleep apnea. It is a serious sleep disorder where patients' breathing repeatedly stops and starts. If you have loud snore, morning headache, dry mouth, or sore throat after a full night's sleep, there are three types of it, which are obstructive sleep apnea, caused by relaxation of muscle in the back of the throat blocking your airways, central sleep apnea, which due to the brain failing to send signal to the breathing muscle, and complex sleep apnea, which is a combination of both. Older age and medical conditions such as lung condition and heart problem are the main risks of developing sleep apnea. As for the medication, central nervous system stimulants such as methylphenidate, modafinil, and amphetamine, which is a first line for narcolepsy, can be used in treating obstructive sleep apnea. It helps increasing dopamine and noradrenaline levels in the synaptic cleft, which bring its side effect of headache, insomnia, tachycardia, hypertension, and suppressed appetite. Additionally, modafinil is approved by the US FDA for use in patients who have residual daytime sleepiness. Next, for central sleep apnea, acetazolamide, which is a diuretic, acts by blocking carbonic anhydrase enzyme, leading to a higher level of bicarbonate in the urine and better oxygenation and breathing for the patient. However, it will cause increased urination, nausea, numbness, and drowsiness. At present, there is no appropriate pharmacological treatment for complex sleep apnea. It is more suitable to be treated by continuous positive airway pressure, CPAP, which will be discussed in the non-pharmacological treatment part. Lastly, non-pharmacological treatment for all these sleep disorders are similar and should be initiated first before pharmacological treatment is started. Firstly, you should maintain good sleep hygiene few hours before hitting the sack. Drinking coffee, smoking, or having alcohol should be avoided 4 to 6 hours before the bedtime. Secondly, negative stimuli such as loud noises, bright lights, and extreme temperature variation should also be avoided around your bedtime. You should also exercise regularly every day. However, be sure to avoid exercising around your bedtime. Next, you should always maintain a regular sleep schedule. For complex sleep apnea, as we mentioned previously in this video, you can always try CPAP, which is continuous positive air pressure that uses mild air pressure to keep breathing airways open while you were asleep. In conclusion, sleep is a vital function essential for health as it allows the body to recover mentally and physically. Sleep disorders significantly affect the health and quality of life of people. Therefore, we must be alert of our own sleeping patterns and their duration. Remember to seek advice or treatment from your medical practitioner if you have any of the signs and symptoms that we have discussed previously. Please like, share, and subscribe to this channel if you are interested to know more about other disorders.